Hi, everybody. Thank you for tuning in. I'm here with Dr. Christina Johns. She is the national spokesperson for PM Pediatrics as well as their senior medical advisor. Thank you for coming today. We are at Rigo Studios Productions, and we are here because we have a skeleton crew. We are practicing social distancing 6 feet apart. We measured. And we are just so grateful that you're here today because we have a lot of really important questions and a lot of misinformation out there. And so
Happy to be here.
Coming to help clarify a lot
So
of stuff.
glad. Great questions, right?
Yeah.
They're fantastic thoughts and input. Really good questions.
Can you please, for those, because I still see a whole group of people saying this is being blown out of proportion, people that I respect, people with education saying this is being blown out of proportion and we're tearing down the economy. Can you please explain what the rule is right now and where you see it headed?
So the strict definition here is that we limit our social distancing as much as possible. And for kids, that means no play dates and really limiting down to the bare bones of just your family. And I think for children, I think the reason is that kids are even less good than adults at keeping their hands to themselves, at remembering to not to touch their nose and their mouths and their faces. And so I think that is really the primary concern, that when I hear about people who want me to come down really hard about, okay, should there be no play dates, no big circle of kids? I know that there are some people who, for childcare reasons or other extenuating circumstances, are getting small groups of kids together. And I think that is, there's a lot of questioning and checking out beforehand about exposure, status, and recent illness that I think are really relevant questions to ask. So I think that the take-home point really is we need to do our best, and I'm not sure that what I'm seeing and what you're seeing, maybe people aren't quite there at doing their best. And what I would encourage people is look abroad, look to the examples of some other countries. If you really are wondering whether or not this can be a serious situation, it really can, and I think experiences abroad really show us that.
Thank you.
Yeah.
Thank you.
The truth.
I know it's hard to control teens.
Yeah.
It's
tough.
really difficult, and they're begging. My daughter's begging me.
Yes.
It is very difficult. So in terms of daycares, so this has come up quite a bit because there's some parents that are required to work out of the home.
Yep.
They are working with the daycares and they're putting their kids in, and people are worried.
Yeah.
And is that something that you foresee, maybe the daycare's not being able to stay open, or is it safe? I mean, people want to know, is it safe to send my kid to daycare?
So daycares are notoriously tricky, right? That's young kids who share a lot of germs, not just potentially coronavirus, but a lot. So I think at baseline, it's certainly tricky. But I think the whole part of the rest of us doing our part at social distancing, flattening the curve to try to decrease the risk of infection spread, is in fact part for these people who have no choice but to put their kids into a daycare situation so that they can work, so that the rest of our economy stays functioning. Okay. So that's really why we've all got to do our part.
Right.
Yeah.
Right. So the CDC just came out and said if you don't have a mask, you can use a bandana. Right. And so we have some amazing moms
I saw
out there.
that.
I know. Out there like, okay, I'm going to make these bandanas. I'm going to make these masks from cotton. And then you've got the other people saying, are you crazy? So what was with that? That kind of concerned me. When they're recommending bandanas, I was like,
understood. So I think that is on the CDC's website, and it is kind of way down if you scroll down, looking at the verbiage under crisis situations. And there is full acknowledgement, if you read down in the fine print, acknowledgement that bandanas and handmade materials are not necessarily effective at doing the job that a mask is supposed to do. So I loved the fact that I saw that. Willingness to help was a tremendous testimony to the human spirit. And that was fantastic for me to see. What I will promise to you and to this group is that I will go back and sort of sort that out a little bit. I think there are legitimate quality issues. I would hate for people to go through the effort of trying to make something that in the end was sort of determined that it would not not be helpful towards preventing infection transmission.
Okay.
But I'll find out.
Thank
We'll
you.
circle back.
And I felt the same way. I was like,
Yeah.
Okay, so something just came out yesterday about the Ebola treatment and with medication that could possibly be effective with a Z-Pak. Is there any news on that? Because we're really working on, there's news coming from like a million directions, and I try to control what people put up, but then it happens so quickly. People are so worried.
It's hard to keep up.
It is. So have you heard about that?
I have, and what I would say is still at this time, there are a lot of fabulous ideas being tossed about by scientists, and I think that that's still early. That is not ready for prime time.
Okay.
It is not something that I think is going to be readily available in the near term.
Okay.
So at this point, we are still operating this as a viral illness. It's supportive care. That's where it is. I know that there are multiple applications as well underway for vaccine production.
Oh, yeah. Can you go into that, please?
Certainly. And so typically once a vaccine application is underway, you typically are looking at about 12 to 18 months before that becomes readily available.
So they wouldn't expedite that because of the situation?
It's difficult to say. I mean, obviously there are safety and efficacy legitimate reasons why we do not. And so I think for this immediate pandemic situation, I think that is not in play for right now.
Okay.
Yeah.
Something else that was posted a lot, and I didn't read through, but Motrin.
Right. Okay, good.
What they're saying Motrin, I don't even know what this means. Motrin's bad for it.
Okay.
I don't even know what that means.
Right.
What do they mean?
So Motrin, which is ibuprofen, Advil, and others. The generic is ibuprofen, and I'm going to call it that. Ibuprofen is a non-steroidal anti-inflammatory medication, so it decreases the inflammatory response. And so there is some small and early data that suggests that perhaps that may prolong illness. That being said, and that came out of, this got publicized over the weekend when a French health governmental official brought that out on Twitter and kind of got things stirred up a little bit. When you look at the broad base of where the evidence lies, so where's the science, right? You and I did this last time. It's facts, not fear, man, and no hype. So where things are right now, it is, and the World Health Organization, in fact, came out and said, we are not saying, double negative, we are not saying don't take ibuprofen, okay? So there's not enough evidence for us to say that ibuprofen is definitely harmful in COVID-19 infections, okay? So that's the truth. If people are concerned, I want to point out that we've got acetaminophen, which is Tylenol and others, that is a perfectly safe alternative to use. So, but I really would love it if we could all kind of speak evidence-based medicine language here and make sure that we're really clear that the evidence base does not say no Motrin right now.
Okay.
Okay.
So that being said, there's some people who are very concerned about the fact that that when they go to get tested or they're thinking about getting tested, they're told, well, first you have to have a flu. Like first they look for strep and then flu and then that, and they feel like that's overkill. Can you explain why we're doing that protocol?
At this point, while we are starting to have more tests available, there is still a limited supply of tests. And this really gets to the fact of, gosh, while we would want to know the results of our test, do we need to know, right? The majority of people who have a coronavirus infection have mild flu symptoms. Some people don't ever have a fever. Some people are even asymptomatic. And so that's really important to know. So who are the people who need to have a test? The people who need to are at-risk folks who have chronic respiratory issues, weakened immune system, the elderly, right? Those are people, or people who are in direct contact with them where that could be really severe. So what's happening again, and this is resource management and risk mitigation, we are trying to say if somebody comes to me and they've got fever and a sore throat, sort of mild flu-like symptoms, if they have strep throat, are they less likely to be co-infected with coronavirus? Gotcha. So I think that it's sort of a marching down a differential diagnosis. And while is it possible to have co-infection with both? It certainly is. Okay. But I think that less likely with what we know now. that may be changing.
So do children,
Yeah.
it's another question, do children look different? Are their symptoms different than adults?
So
for COVID-19?
what an excellent question. And so yes and no. I think it's really variable. Again, it appears from the early data that young kids get infected less severely than older children, but we have seen kids who have been in the ICU. So there are some kids who do have significant pneumonia and significant respiratory and lung compromise due to this infection. But does it look the same in terms of fever and cough, that type of flu-like symptoms? It does.
Oh.
But there's a wide spectrum. I mean, I think with both adults and
everything.
children. With
everything,
You got
right?
it.
I mean, and that's the thing. You can meet someone that had the flu A or B.
Yeah.
And one person's like, dear God, I was out for 2
Yes.
weeks. And another
Yes.
person's like, oh, mine was only 3 days.
Right.
Which brings me back to elderberry.
Okay, yeah.
Came up twice, actually. So is elderberry, is there any clinical support for treating children? Not solely. I don't think anyone's saying only elderberry, but
Of course.
does it help? And also, can I weave in zinc?
Right.
Because I just saw someone else post use zinc.
Right. So certainly I'm going to speak as a pediatric emergency physician and pediatrician for the evidence base on using elderberry in children and say that there is no evidence base for using elderberry in children. Is it harmful? Well, probably not. If the preparation is done appropriately, that's a little bit tricky, and I'll speak to that in a minute. But there is no definitive data with a large enough study size in children that says to us, if you give your child elderberry, it will help boost the immune system or help prevent infections. The data just isn't there. It just
what
isn't.
about zinc?
Same deal.
Same with zinc.
Yep, exactly right. for
So
those
I think we're
preparations.
all just God out of our minds, like trying to think of ways to help support our immune system. So these questions are just, thank you so much for answering them. They're so
Happy
important. Okay, so if your child or yourself just had, let's say, the flu or pneumonia, are we now considered immunocompromised?
Great, really, really good question. I loved this one just because it is really drilling down into the science details. So what we know about people, when you have an infection, your inflammatory system is revved up. So that is the deal for sure. However, your reserves are weakened a bit, right? Because your body's working overtime. Right. So technically, do you have a weakened immune system? No, not technically, but are your reserves a little bit low? Most people are, and what I mean by that is most people who are sick are by definition a little bit dehydrated, a little bit low on volume. So again, we could really get in the science here, but I think that that's a little bit of a tricky answer. Technically, not weakened immune. Is your reserve down? Yes.
How long does that generally take for someone who's normally healthy to get back to where they were after being sick with something like pneumonia or the flu?
Really variable for people. Some people will, after pneumonia, will have a post-infectious inflammatory cough, and it's like they're coughing for 2 months, and you just can't even believe it, right? They're exhausted and tired. They feel okay, but coughing so much that they're tired and their reserve is down. Other people within the matter of a week or two are really feeling back to themselves.
So it's just
self-monitoring.
It depends on how if they're still showing symptoms, then they're probably not where they were. And if they're starting to feel better, their energy's back, then
you got it. There's a lot of self-monitoring.
We can do this, moms. We can
do hard things, right? We can do hard things.
We can, and it is tough. I think
it is.
We are literally now homeschool teachers. We are now.
Everything.
I mean, we're so many things. It's
right.
And I wanted to go to ask, and this wasn't a question posted, but I think it's important. PM Pediatrics has telemedicine. I know some other doctors' offices are on their way.
Yes, indeed.
And so I wanted to talk about that because before all of this, we were told you have to come in so I can see you, so I can examine you. And now we're saying not everything, but a lot of things can be handled through telemedicine. Can you explain why there's that shift, and is it just as good or is it safe to use telemedicine?
So telemedicine is good for certain things. Is it good for everything? It is not. Are there some times when people might call and have a telehealth visit, a virtual visit, where they're told, gosh, you know what, it sounds like based on what you're telling me that you need to go in and actually be seen in person? That's going to happen in some cases. But I will say that many medical practices at this time are changing loosening some of their stricter guidelines in the interest of greater public health. And what I mean by that is I have seen people for whom they have had a virtual visit where they describe symptoms that look like classic strep throat. And where you're able to see, even using your smartphone and your light and showing what your child's throat looks like, where we've loosened some of the guidelines on antibiotic stewardship. I have seen that happen. I am not saying that it's right for all situations, but I think when we are speaking about crisis mode in healthcare and the greater good, those are some of the things that are being considered at this time.
And that's how telemedicine works. Or telehealth. It's literally the parent is helping to explain or show. Is it video? Is that how it works?
Exactly right.
Video?
That's exactly right. Most of the time. You can do it just by phone as well. By phone, that definitely limits even more what is successful.
It's amazing.
It's so
really
cool.
amazing.
I mean, I got to tell you, wait till you see the technology.
I just got goosebumps. I like the idea that that we can help in this way, but also think of how many times someone doesn't have transportation.
All of the things.
You know, it's I think it has larger impact than just right now. So that's really exciting.
Yeah.
So someone saw on the news that a cruise ship had symptoms for only 48 hours, but continued to test positive for almost a month.
Right.
What are we seeing? And I know we have limited time. But what are we seeing? Like the shedding, they're talking about shedding happening before.
Yeah.
Can you just briefly walk us through that process?
Sure.
Of what we know today, because what we know today is different than what we knew yesterday.
We're learning more every day. That's right. And so currently, the generally accepted window is that when you've been exposed to when you demonstrate symptoms, about 5 days or so. So that's sort of that end. And then the guidance at this point, if you've had the coronavirus infection, that you need to be isolated for 14 days. So is it possible for somebody to shed virus for longer than that? It is certainly possible, but you dramatically can decrease the amount of virus that you shed at around that time period. So that is the current ask from all of the regulatory agencies.
And that's why we're doing the social distancing, because people don't know.
That's right.
For up to 5 days before they're even symptomatic.
That's right. And it's also when you go in to have a medical visit, if you or bring your child in for a sprained ankle, would I put a mask on? Absolutely, to protect you and to protect me. Not because I'm worried about your child's sprained ankle, but because it's hard for any of us to know who's been exposed, and they may be in that early window.
Okay.
Yeah.
And I just want to come back, because this is asked a lot. The shedding of clothes. People are going.
Yeah.
I have friends that are physicians who literally strip down in their garage, put all their clothes into a. If I'm just a gal and I've been here today and I'm going to go back home, what should I do?
So I think if you have had and not encountered any sick people in your office, that's assuming that you're going about your work day. I think that good hand washing is really fine. Does it make sense to change clothes? Is it reasonable to leave shoes outside? Absolutely. All of that stuff, again, it's more risk mitigation. Might it be overkill? Maybe in some situations, but I think if we look back at this and are like, wow, we managed that okay. Did we I'll be glad if we overreacted and things turned out better than we anticipated.
Awesome. So risk, just to circle back, if we want to have the least amount of risk, yes.
Sure.
Change your clothes, go take a shower, wash your hands, whatever.
Sure.
But just use your brain.
Absolutely. Definitely for healthcare workers. I mean, we are recommending that many healthcare workers even wear scrubs. People who normally would wear street clothes to take care of patients to wear scrubs for that reason.
Okay.
Yeah.
And so a woman posted that her husband travels by airline twice a week. should he be coming home? A tent outside for you.
You know, we kind of smile about that, but there are people who are electing to self-isolate during this time where the infectious contagiousness is escalating rapidly. And so I think that, again, that is not the craziest idea that I have ever heard. I think on an individual basis, I would really encourage people to talk with their healthcare provider to make sure that they're making decisions that are right for them.
Okay. Why is there a disconnect between what the CDC is saying of social gatherings of 10 and less versus the governor saying
nobody
stay home?
Yeah.
Versus doctors, you know. So what is up with that?
Yeah, that's a really good question. And I think that this gets back to the fact that this is all brand new for us as a medical community and as for a nation as a whole. And so are there established definitive best practice guidelines out there right now? No. People are doing their best to estimate and to pivot when the situation changes. You know, it's kind of like asking, why was it okay for people in San Francisco to be out and about a week ago and now they're on total lockdown, right? Because things have changed and we're going to pivot with those changes. Will those changes always be aligned and line up? Probably not, because there's no best practice out there and everybody is sort of catching up and analyzing different amounts of data at the same time.
Right.
Yeah.
And I think everyone is looking at each situation and asking their specific question.
Yeah.
There's a lot of families that are multi-generational.
Yes.
Where grandparents are babysitting children,
Yeah.
or they all live together.
Right.
What is being recommended at this point if people rely on the grandparents to babysit? What say you about that?
So I think that, again, this is the element of real life that gets injected into this whole situation. And so the easy one first. Do I recommend that people have their grandparents who don't live with them visit? No. Is it time for you to go visit your grandparents? No. Are they household contacts who live in your house or who are in your house on a daily basis? They are part of your everyday. And so that's your immediate family unit. And so that, for many reasons, has to go on. Do we try to isolate as much as we can? For many, when there's a baby, when there's a little one, that may not be possible. But this is where I would really charge people. If you are somebody who washes your hands 5 times a day, make it 10 when you are in that situation.
So extra careful, good practices.
If you can avoid,
Right.
Totally acknowledging that it is not possible in every single case.
So someone said, I keep reading that steam will help with treatment of COVID. Is that true? If so, is it cool mist or warm mist?
So, right. So I don't think that there is any definitive evidence on that. I think really the better part of valor here is to pivot to bleach-based cleaning. And a comment about that. People always get super freaked out about bleach. Like, I can't have bleach, is so dangerous in my home. And it's really important to distinguish between commercial bleach and household bleach. You don't want to have a commercial bleach preparation at home, but the household bleach is absolutely fine.
Clorox bleach.
Totally, Clorox bleach.
And then what is the mixture?
So depending on which type, there are other brands other than Clorox. So read the label. Sometimes it's like a 1/4 cup per gallon of water, and that's what you want to use. One of my favorite tables in my pediatric emergency medicine textbook is a table that says substances that are non-toxic when ingested, swallowed in small amounts, and one of them is household bleach. Non-toxic.
Really?
Total shocker.
I mean, don't do it.
Right. Okay. Not suggesting ingestion, but for little kids, right, accidental ingestion is something that as a pediatric emergency physician, something I see.
I can only imagine.
And so it is good to know the things that are not necessarily completely toxic. And I bring that up to reassure people. Again, not advocating drinking it, and you must store it out of the reach of children. All of those safety things and injury prevention still apply, but that it is perfectly safe to have. And I think that that's a good one. Use it. The guidance here on cleaning is when you have your wipe or your cloth made with your bleach solution, you want to get the surface wet, and it needs to stay wet. So a lot of people just, wipe down, they think clean, and then they dry down. That's not what you do. It needs to get on the surface, stay wet, a couple minutes or so, needs to stay wet till it dries down a good bit, and then wipe down.
Okay.
Yeah.
We have to wrap this up, so I have 2 things. One is I misspoke, and it was the malaria drug, not the Ebola drug.
Right, yeah.
So I just want to make sure everyone knows.
Right. So no tonic water either. I knew what you meant, but yeah.
Because other people might not know. Yeah. Okay, and so the other thing is, and I've asked you this before, but I think I want to ask it again. How long will it take? And I know we don't know exact, but we're trying to understand, like they say, when this passes. And what does that mean? And how long will it take, do you, just from what you know today?
Sure.
What do you think?
So what I think that best case scenario, I think somewhere between 8 to 12 weeks, I think we will start to see the light at the end of the tunnel. That's the modeling that I have seen, legitimate science modeling. And I'll be more than willing to be wrong if it's shorter, but I feel fairly comfortable saying that, are we going to be through this in 2 weeks? I think there are a lot of people who believe that, all right, we sort of set up this 2-week arbitrary endpoint. I don't think that that's the case. I don't want people to be lulled into complacency that we will be out of this in 2 weeks. I think this is a marathon. It's not a sprint. We need to not let our guard down in terms of our own infection control behaviors. And I think if we can all do that, then we'll do better getting through this. But I think it's going to be longer than a couple of weeks.
Okay.
Yeah.
We so appreciate your time.
Happy to be
We're so
here.
grateful. Please keep fighting the fight, because we know it's really tough for you guys out there right now. And we're really so grateful for you. So
thanks.
Everyone, please share this. Please make sure that you abide by the recommendations. And we really look forward to keeping in touch. And we thank everyone that made this happen.
Thanks.
Thank you so much.
Thank you.